Good evening, everyone, and thank you for joining us for Coronavirus Know the Facts. I'm Bob Donaldson.
I'm Debbie Knox, and over the next 30 minutes, we'll update you on what you need to know about the ongoing pandemic in the Hoosier State.
Let's start with the COVID-19 numbers across the Hoosier State as of today. More than 12,000 cases being reported to the State Department of Health. More than 600 Hoosiers have died from coronavirus. Nearly 70,000 tests have now been reported to the state.
Now, our review of the number of coronavirus tests conducted in Marion County shows that over the last 9 days, almost 1,300 tests have disappeared off the county's total on the State Health Department website. Now, the Indiana State Department of Public Health says the current numbers statewide may not be accurate because of technical problems. These are the very statistics that state leaders need, though, to consider when determining when to relax Indiana's social distancing guidelines and gradually ending the shutdown.
We should start seeing the total number of positive cases start to come down. We're in the 400, 500, 600 range right now.
Now, one national model recommends rolling back Indiana's social distancing orders around May 20th. The model at the Fairbanks School of Public Health at IUPUI makes no such recommendation. It does predict the coronavirus surge to hit Indianapolis in the next week and the rest of the state by the middle of May.
And there is a new push for more testing tonight. The state's goal is to test more patients to track the virus's spread before the Indiana economy can reopen. State Health Commissioner Dr. Christina Box says there is enough lab capacity to accomplish that, but there's still a shortage of testing equipment and of locations. Even those without symptoms who may have been exposed will eventually need to be tested.
I think because sometimes we think that the clinical picture, it doesn't make a difference in how we're going to treat this particular individual. Sometimes we don't test. And the problem is that when we don't test, then I don't have that positive test to follow up on from a contact tracing and making sure that we find out where that individual's been and who's been in contact with them.
Governor Eric Holcomb says we can expect to learn more about Indiana's PPE supplies during tomorrow's news conference. Some state lawmakers and patient families are calling for more transparency on cases in long-term care facilities. Indiana plans to provide weekly updates on statewide totals. The State Department of Health will not disclose the families. One family member says her father lives at Bethany Point in Anderson as of Friday. The company that operates that facility says 30 residents have died there. The family member claims no one has told her the total number of cases in that facility.
Do you have 30? Do you have 2? Do you have, what do you have? What have you got going on so that I can make an educated decision on what I want to do?
The state reports 162 deaths in 74 long-term care facilities. And we're joined now via Skype by Dr. Ram Uledi, the Community Health Network Chief Physician Executive. Dr. Uledi, thank you so much for joining us again.
Yeah, we want to start, Dr. Uledi, by talking about the peak and the surge estimates that we just estimated and talked about. What are you seeing in the hospital and the tracking data? Do you still think that Indianapolis is on track to hit its peak by next month?
The issue with kind of identifying a peak or a surge is really like predicting the course of a hurricane. You take several models and try to make your best guess and plan for the worst case scenario. So for our hospitals, Community Health Network, over the past 10 days or so, we've had about the same number of patients in the hospital with COVID-19. So there's not been an increase in that. But again, we're very cautious, though, because it's hard to predict, are we going to get more patients in the next 10 days or so. So for now, we're staying flat. But there's just enough concern out there that we want to be cautious about how we prepare for the next 2 weeks.
So as we said, testing is the key. Testing is the key to getting the Indiana economy back open. And we face, I think, different challenges in testing than what we faced in the past. We heard state officials talking about some of the equipment not being available and also getting some of those tests to the patients who need it maybe in other parts of the state. Can you talk about some of the testing challenges that we face right now?
Absolutely. I think Dr. Box is exactly right, is that the way you move from a shutdown to opening up the state and getting back to something different than we are now is testing with everybody, finding out who their contacts were. Anybody that's positive, find out who their contacts were by contact tracing. and then isolating those individuals. If you can do testing, contact tracing, and isolation, that will definitely get us in the right direction. But we're very limited in the number of tests, the number of swabs we need to use for the tests, and the reagents for the tests. So I know there's a lot of work being done, but we do not have enough tests right now to the extent that we really need to be able to open up the economy, though.
It's interesting the state saying that the lab capacity is there. It's just a matter of getting the tests done. Also, you talk about contact tracing. That is another piece of this equation, correct? You have to get people tested, but then you also have to trace who they've been in contact with. Talk about who does that and how important that is for opening the economy back up.
And that you're right. That is very challenging because that requires manpower. There's a couple ways to do it. Apple and Google have partnered to try to figure out apps to try to figure that out to help with us. But at the end of the day, it requires manpower to call those individuals, find out who they've been around, and then contact those individuals. So it's going to be a huge manpower effort, which I think we can get done. But it's going to take a lot of infrastructure, a lot of resources, and a lot of people to help get there.
Yeah, I think we have heard that it's taken an army of people to get that done. I guess we're going to be putting that together. Dr. Uletti, the big question now is shifting to reopening and when the state will be ready to lift some of these restrictions. Do you think that is something that should happen in the near future? Are you worried that we're opening things too quickly? What's your feeling about that?
Yeah, I think one thing we cannot forget is that COVID-19, we still don't have any treatments for it, and it's still just as contagious as always. And the only reason we have our volumes that we could handle is because no one's touching anybody. So as we open things up, people are going to be getting in contact, even with social distancing. You're going to be contacting other people. So there's definitely going to be more people getting the virus and getting sick. So we just need to use a lot of caution and as best we can and be very thoughtful on what we want to open up and how we want to open up, especially since we don't have enough testing yet. So I would say there's a lot of caution in terms of what we do. I know there's a lot of cabin fever. People want to get out. So how do we balance that? Because it's still just as contagious as it always has been.
There are fears that we would get a resurgence if we opened up too quickly in the short term. But even today, there was a lot of talk about a resurgence in the long term, maybe in the fall, in conjunction with a flu virus. Can you talk about those possibilities and the dangers there?
Yes, so again, the only long-term way out of this is through a worldwide vaccine, vaccinating about 3 billion people. So the problem is in the fall, the only people that potentially may not get COVID-19 is if you've had it in this season. So that's a small portion of our Hoosiers. So there's a lot of people that have not had COVID-19. And then on top of it, if you have a bad flu season for influenza virus, you have two different viruses, influenza and coronavirus. That could actually put a big strain on everybody and cause a lot of sickness and sadly a lot of death. So we definitely have to keep that on our radar, no question about it.
Oh, it sounds like we still have our work cut out for us, and we're not through this quite yet. Would you agree with that, Dr. Uletti?
Yeah, absolutely. I know we want to see that light at the end of the tunnel. We are making great progress. I thank everybody, thank the governor, thank Dr. Box, and thank every Hoosier for doing their part. But this is still the beginning, and we do have a long ways to go. So this is a marathon and just need everybody patience and diligence with this.
Are you concerned about even a short-term resurgence if people let their guard down and start heading outside without taking precautions?
Yes, I definitely am. We are actually prepared within our system. We plan for another resurgence in the next 4 to 6 or 8 weeks or so. I do see more cases happening simply because it's just as contagious and people are going to be coming in touch with each other. So there's definitely going to be some resurgence. How much, I can't say.
All right. Dr. Ram Uletti, thank you so much for being with us tonight. We appreciate your time.
Absolutely. Thank you very much.
All right. Well, new data is showing why senior citizens and those with underlying health issues are most at risk for contracting COVID-19. The stats also helping us to understand why some young people have died from the virus while others have recovered. Butler University biology professor Christopher Stobart says it has to do with your genetics. Stobart says that just because you're considered healthy doesn't mean that you won't really get sick. Researchers don't know enough about the virus to predict how your body will react.
Some of us get colds more often than others. Some of us come down with skin infections more often than others. And those are variations in our immune response to pathogens.
Stobart knows of at least 40 different research companies that are working on coronavirus vaccines right now. And right now, a large majority of small Indiana businesses have so far failed to get federal assistance. According to one study, only 20% of businesses had their applications approved from the first round of government stimulus funds. The overwhelming majority either got nothing or are still waiting. Well, now they could get a second chance after the Senate approved $310 billion in additional funding for that payroll protection program.
I can count on one hand the number of folks who've actually received the money.
I don't know if there's going to be a third round of this, right? So this may be your last chance. Without sounding alarming, this may be your last chance to save your business.
Financial experts say small business owners looking to get approved for the second round of funds need to act fast and start calling their banks today. Well, new numbers show many Indiana restaurants facing a dire financial future. On average, Indiana restaurants have lost 77% of their sales compared to the same time last year. That's more than $900 million in losses this month alone. Across the state, an estimated 83% of all restaurant workers have been laid off since February. Some local owners say they are struggling to survive.
The pandemic has devastated the hospitality industry. Many hotels are closed right now. Tourism, non-existent.
The effects have already been devastating, and I don't think we can assume that this is going to be a light switch where all of a sudden the economy turns back on and people are ready to gather in our establishments. This is going to be an incremental process. Of course, the landscape is changing every day.
State groups estimate the Indiana hospitality industry has lost nearly 110,000 jobs. The association established a special fund for employees who have been laid off or put on furlough. It took less than 48 hours for that association to raise more than $90,000 in grant money.
Hospitality is comprised of folks who have literally made their career out of serving others. They are an inspirational group of people who know community best. They pull together, they help one another out. I would just ask them to continue what they've been doing and finding ways to serve and encourage the public to turn the tables and find a way to serve in return those hospitality workers.
To learn how you can donate or need to apply for a grant, just look online at cbs4indy.com/links.
Well, the month of April is almost over, meaning the rent will be due May 1st. Tonight, we're taking a look at the protections for Hoosiers who may not be able to make rent and why the state's moratorium does not apply to a certain group of Hoosiers. Coronavirus, Know the Facts returns in 2 minutes.